Okay, everybody, Dr. Rafich here from Vet Triage. We're continuing through this issue of JAVMA from June 15, 2015. We are talking about pathology in practice, and there you can see that pink tissue with the scalpel handle. The J is jejunum, and the asterisk is a mass associated with the jejunum, and there's the scalpel handle for size. And then the other image, the J is jejunum, and then the asterisk is the mass on cut surface, and you can see that the mass has nothing to do with the lumen of the jejunum. So this is a 2-year-old Cocker Spaniel. During a spay, they found this mass, so they resected, and that's the most, the jejunum. The mass was found to be firm, sticky, and gelatinous, but no communication between the mass and jejunum. The mass was found to be focally arising from the outer layer of the tunica muscularis of the jejunum, with a large cyst-like structure filled with necrotic debris, amorphous material, and a small number of leukocytes and few cholesterol clefts. The lumen of the cyst contains abundant necrotic debris and hemorrhage, so that's what's being shown. Here's jejunum, normal jejunum, and here's the debris and hemorrhage. They found goblet cells and columnar epithelial cells with a brush border. That's the arrow here. So the brush border is that fuzziness there, and these are goblet cells. You can see they're filled with mucus, and the blue staining shows mucus. Morphologic diagnosis is a jejunal duplication cyst with minimal segmental lymphoplasmacytic and eosinophilic jejunitis in a dog. Comments. Cystic enteric duplication is a rare congenital malformation that has been found in humans, most often children, but also dogs, cats, goats, and horses. These typically consist of a blind pouch or cyst attached to the alimentary tract, which is the gastrointestinal tract. They are most commonly associated with the ileum, but can be anywhere, including esophagus, stomach, small intestine, and colon. Although they may be subclinical in animals and humans, affected individuals could have nonspecific signs based on location, including choking or respiratory distress with the esophagus, epigastric pain, vomiting, diarrhea, constipation, depression, abdominal distension, peritonitis, tenesmus, rectal prolapse, and signs of back pain. You can try and diagnose this with plain radiographs, CT, MRI, barium enema, abdominal ultrasound, and then other cyst-like masses like enteric diverticula, hematomas, or abscesses should be considered. The smooth muscle wall distinguishes duplication cysts from false diverticula, which are outpouchings of the intestine that lack smooth muscle, and that's why it's important with the histopathologic findings here. They mentioned the muscularis being affected by this, because that's what confirms the diagnosis here, versus a diverticula, which is an outpouching which would not have the muscular layer. A Meckel diverticulum is a true diverticulum that contains all 4 layers of the intestine, and in humans is found on the antimesenteric border of the ileum, approximately 60 centimeters from the ileocecal junction. It results from failure of the vitelline duct to completely close during gestation. These are most common in humans, pigs, horses, rare in other species. A duplication cyst that communicates with the ileum and located close to the ileocecal junction may resemble a Meckel diverticulum on gross and histologic examination using technetium TC99M pertectinate scintigraphy. The diagnostic technique of choice can identify a gastric mucosa associated with a Meckel diverticula, but this finding may result in inaccurate diagnosis because duplication cysts can also contain ectopic gastric mucosa. Treatments for humans with clinical signs related to Meckel diverticulum or duplication cyst requires complete excision, and the prognosis is favorable. The digestive tract initially develops from yolk sac endoderm, which eventually becomes the intestinal epithelium, followed by a rearrangement and coalescing of epithelial vacuoles to form the lumen. You want to perform surgery on these patients to avoid potential future complications like obstruction, perforation, or potential malignant transformation of the cyst. Successful surgical removal of a duplication cyst involves the esophagus, jejunum, and colon have been reported in dogs, cats, and a horse. But euthanasia can be selected in complicated cases that have other congenital malformations. So this is a great study. This is what you're talking about here. So you have a rare disease that is found in people and animals. It can be confused with other conditions, and so this is what you want to see with this type of thing. So for veterinarians, just be aware, of course, that when you perform a spay, we usually try to perform the spay with as small of incision as possible, but you do end up missing other things like this, although these are rare, of course. Anyway, so just a thought process there. And then for pet owners, realize that animals can be born with defects that are not showing any symptoms, and so this is a prime example of that. Whether or not this would have caused symptoms in the future is hard to say. This dog was already 2 years old. Yeah, 2 years old at the time of the spay, which is typically older for a spay procedure. It'd be interesting to know if they had spayed this dog at like 6 months of age, would they have even noticed this, or did this grow over time? And so of course, we're not going to know that. So, a cool case report here from JAVMA, and hopefully helps you guys out. And we'll see you in the next one. Take care.